Hello friends, welcome to my channel Clinical Biochemistry by Dr. P.K. Prabhakar. In the vitamin series, this is the third lecture where we are going to talk about vitamin E. This is the basic broad classification of vitamins. We have already discussed about the basic classification of vitamins on the basis of its solubility. So on the basis of vitamin solubility, we are having two broad classes: fat soluble vitamin or lipid soluble vitamin and water soluble vitamin. There are four vitamins which comes in the fat soluble vitamin. They are A, D, E and K. So normally if you see the structure of these four vitamins, they are having lipid more hydrophobic chains, and two vitamins you can call it, or two category you can call it, vitamin B, which is a large category where we are having 9 vitamins, and vitamin C, they are falling into the water soluble vitamins. So in this series we are going to talk about vitamin E today. Now let us know first the introduction about the vitamin E. The chemical name of vitamin E is tocopherol. There are different, you can call it, vitamins are there. Later on we will talk about those vitamins also. So vitamin E, which is chemically known as tocopherol, is naturally occurring antioxidant, because one of the most important function of this vitamin E is it works as an antioxidant. And because of this, their antioxidant activity, these vitamin E are going to involve in many different functions, many different kind of activity they are performing. This vitamin E is essential for our normal reproductive processes, because it maintains the different cells of our reproductive system. So it is essential for the reproductive system, and that's why it is also called as anti-sterility vitamin. In absence of vitamin E, the reproductive process will be lacking. Vitamin E is also going to be described as the vitamin in search of disease, because there are no disease. This is due to the lack of any specific vitamin E deficiency disorder. Till now we don't have any disorder which is going to happen because of the deficiency of vitamin E. So that's why this is one of the very important vitamin, or you can call it is one kind of boon we are having, which does not have any defect, which does not have any deficiency disorder. So this is called as vitamin which is in search of disease, that is vitamin E. Ivan and his associate in 1936 isolated the compound of vitamin E activity and named them as tocopherols. The Greek word, this tocopherol, comes from the Greek word which means tokos means childbirth, and pheros means to bear, all means alcohol. So from there its name came. If you'll see the basic chemistry of this vitamin E is the name given to a group of compound where two broad category of compounds comes: tocopherols and tocotrienols. If you'll see, so this is the family of vitamin E, where we are having two broad classes, that is tocopherols and tocotrienols. Tocopherol have four different category, that is alpha tocopherol, beta tocopherol, gamma tocopherol and delta tocopherol. Similarly, in this case of tocotrienols, trienols means tri means three, in means double bond, all means alcohol. So later on you will see, when you will see the structure, that time you can differentiate what is the exactly meaning of tocotrienols. Similar to tocopherols, tocotrienols also we are having alpha, beta, gamma and delta. So overall we are having 8 different forms of vitamin E, and these 8 vitamins are called as vitamins of vitamin E: 4 tocopherols and 4 tocotrienols. Among all these 8 vitamin E derivatives or vitamin E compounds forms, alpha tocopherol is the most active, means this compound is the most active compound we are having. The tocopherols and their derivatives of 6-hydroxychromanone tocol ring with isopyrenoid 3 unit side chain. The antioxidant property is in the vitamin E is working as a very good antioxidant activity, and the main reason of their antioxidant activity is because of this ring, chroman ring. So whatever this chroman ring we are talking about, so this chroman is essential for their antioxidant activity. If you'll see here, this is the basic structure of tocopherol and tocotrienols. Roughly everything is same, like this is the chroman ring which is present in tocopherols also, tocotrienols also. Why? What is the meaning of R1, R2, R3? That I am going to talk about. In the case of tocopherols, if you'll see, we don't have any double bond. Okay. In case of tocotrienols, this is tri-in, means we are having 3 double bond. So because of this 3 double bond, it is called as tri-in, and because of this alcohol, it is tocotrienols. So that is the basic difference. Means if you will see the tail, this is we can call it the tail of vitamin E. In case of tocopherol, it is saturated, whereas in case of tocotrienols, it is unsaturated. Now this R1, R2, R3, there are different types of, either hydrogen will be there or methyls will be there. So depending on their hydrogen and methyl presence, we are going to call it alpha, beta, gamma and delta. So if you will say, if R1, R2, R3, there are 3 compounds, if all the 3 at the 5th position, 7th position and 8th position we are having alpha, it will be alpha. So here also you will have methyl, here also you will have methyl, here you will have methyl. So if this side chain is saturated, we will call it alpha tocopherols. If this side chain will have double bond, it will call it alpha tocotrienols. Similarly, if the position number 1, that is 5th, and position number 8, so 5, 8, then I will write it here. This is 5, 7 and 8. In case of beta, it will be 5 and 8. In case of gamma, it will be 7 and 8, and in case of delta, it will be only 8th position. So this is how we are going to call tocopherols and tocotrienols. So this is overall tocopherols and tocotrienols. So total we are having 8 different vitamins of vitamin E. Now if you will see, whenever we are going to get this vitamin E from external sources, how this is going to be absorbed in our body. So the vitamin E is going to be absorbed along with the fat in our small intestine. These bile salts are necessary for their absorption because it is a fat soluble vitamin. So without bile salts, it cannot be absorbed properly in our body. Vitamin E is also absorbed in the intestine, packaged in the form of chylomicron. You might be knowing that we are having different types of lipoproteins, that is chylomicron, VLDL, HDL, LDL, IDL. Chylomicron is the lipoprotein which normally our intestinal cells make. We make in intestine for the transportation of all the lipid or lipid soluble substance to be transported from intestine to the liver or different other places. So chylomicron is going to transport vitamin E from the intestine to the liver. It is delivered to the tissue via the chylomicron transport. Normal as lipid is going to be transported from intestine, and then to the liver to the chylomicron remnant uptake. I will show you the diagram also. The liver can export vitamin E in very low VLDL form. So if you will see, just I will show you the picture. Within the liver, this alpha tocopherol transfer protein preferentially transfer alpha tocopherol to VLDL. So in the liver, we are having a specific protein that is called as alpha tocopherol transfer protein, and this protein is responsible for the transportation of vitamin E from liver to VLDL, so that it will be transported to the non-hepatic tissue. Due to this lipophilic nature, vitamin E accumulates in the cellular membrane, fat deposits and other circulatory lipoproteins. Vitamin E also going to be stored into the adipose tissue, liver and muscles. The normal plasma concentration of tocopherol is less than 1 mg per dl. This is how it is going to be transported in our body. Whenever we are going to eat, we are having a dietary vitamin E. From dietary vitamin E, it is going to be formed chylomicron. Chylomicron will come into the circulation. From circulation, it will be partially triglyceride will be metabolized. It will be converted to chylomicron remnant. This chylomicron remnant will be taken by liver. In the liver, we are having a specific protein, and that particular protein is necessary for the transportation of vitamin E onto this VLDL. This VLDL will be again partially metabolized during the transportation, converted into IDL and LDL, and ultimately it will be transported into the other non-hepatic tissue. So this is how it will be absorbed, and it will be transported to the other tissue. Now comes to the most important part of this vitamin E, that is their function. Most of the function of vitamin E is related to its antioxidant property. It prevents the non-enzymatic oxidation of different cellular components. Now, because you know that most of the cellular components have unsaturated fatty acid, and they are very prone for oxidation. So this vitamin E protects our cellular components especially these unsaturated fatty acids by molecular oxygen or free radicals. And selenium is another element which helps vitamin E in this particular processes, in this protection process. Vitamin E is lipophilic in character and is found in association with the lipoproteins, fat deposit and cellular membranes. It protects the polyunsaturated fatty acid from peroxidation reactions. Vitamin E acts as a scavenger and gets itself oxidized to quinone forms by free radical and spare PUFA. This is the reaction. Vitamin E is lipophilic. So if you see the structure of vitamin E, this is the chromine ring where we are having OH group. During the oxidation reaction, this H is going to be removed here. So H is going to be removed from the vitamin E, and so it works as a antioxidant process. So the main purpose of, or the main function of vitamin E, which works as antioxidant, for that one this chromine ring and especially this hydroxyl group is responsible. Now if you see the different function of vitamin E is one of the essential component for the membrane structure and their integrity, their maintenance of the cell structure. Hence it is also considered as the membrane antioxidant. This vitamin E prevents the peroxidation of different kind of lipids, different kind of fatty acids, especially PUFA, polyunsaturated fatty acid, in different membranes. So it protects the membrane. Because it works as it protects the membrane of different cell, it also protects the membrane of RBC and protects RBC from the hemolysis by different oxidizing agent like hydrogen peroxide or any other components. It is closely associated with the reproductive functions and prevent the sterility. So that's why it is called as anti-sterility vitamin. Vitamin E preserves and maintains the germinal epithelial cells, gonads, for proper reproductive functions. So it helps in the maintenance of germinal epithelials, and so the gonads will form there, and it will be called as anti-sterility vitamin. It also increases the synthesis of hemoglobin via the heme synthesis enhancement by regulating the by increasing the activity of two specific enzymes, that is, one is 6-aminolevulinic acids synthase and LR dehydratase. These two are the enzymes which is responsible, which is involved in the heme synthesis. So because heme synthesis will be increased, so ultimately hemoglobin synthesis is also going to be increased, and for that one vitamin E is one of the essential component. Vitamin E is required for cellular respiration through electron transport chain in the inner membrane of mitochondria. And how it is going to required for cellular respiration? So it is thought that it involved in the stabilization of coenzyme Q, which is the one of the specific or important electron carrier in during the ETC, electron transport chain. Vitamin E also prevents the oxidation of different other vitamins like vitamin A and vitamin A precursor, that is carotenes, beta carotenes. Vitamin E have several other functions. So we are having some specific functions, 7 specific functions of vitamin E, where we are going to call vitamin E as a magic for skins. Vitamin E can magically act on the skin. Vitamin E and its oil can enhance our skin moisture. The moisturizing benefit of vitamin E may help the skin look more radiant and less wrinkles. So it is anti-wrinkles also going to have its anti-wrinkle effect on the skins. It treats allergic reactions, itching of skins and dryness of the skin. Some studies suggest that it may lower the risk of skin cancer also. One study have also suggested that the topical application of vitamin E can reduce the psoriasis symptoms. Second important thing is it helps in the promotion of nail health. Vitamin E contains antioxidant which helps in the prevention of yellow nail syndromes and cracked cuticle of the nails. It also strengthens the brittle of or dry nails. It is one of the important, excellent for our eyes because studies suggest that studies reveals that vitamin E supplementation lowers the age-related eye damage and improves eyesightness. Some data shows that vitamin E decreases the progression of cataract. It is also working as a immunoboosters. Vitamin E may enhance our immunity and keeps our body health as age is going to increase. Daily supplement of this vitamin can boost our immunity. Vitamin E is full of antioxidant which helps our body to fight off the infections. It also reduces the heart decreases means risk. Vitamin E supplementation can prevent the risk of heart disease and by lowering the bad cholesterol, that is LDL. It also prevents the blood clotting formations which leads to the heart attack or strokes or atherosclerosis. It alleviation of the chronic inflammations. Vitamin E helps in the reduction of the chronic inflammation caused because of the type 2 diabetes mellitus or certain heart failure. Lastly, it boosts the male infertility. Vitamin E improves the male fertility by enhancing the growth of sperm. Men with the infertility show the significant improvement in the fertilization rate after taking vitamin A supplementation for more than 3 months. Now, these are the some same almost similar type of functions where it is required for different other activities, different other functions. The vitamin E is these are the recommended dietary allowance of the vitamin E. It is required for different age groups. We are having the requirement of 6 to 11 mg per day. As age is growing on, so supplements should be increased in case of male and female also. Roughly, it will requires in case of adult one 15 to 19 mg per day. The food, there are different foods where this is going to present in the high quantity. Like if we'll see the vitamin E is found naturally in different foods in the form of alpha tocopherols. Like for sunflower oils, if you'll see it, sunflower seeds are power snack loaded with the vitamin E, essentialites, fibers, potassium, and number of other components also. Then second one is avocado is one of the yummiest source of vitamin E. It is placed packed with the fibers, antioxidant, and low in fiber. Just one avocado contains 20% of vitamin E. Then spinach. Spinach is one of the best source of several essential nutrients such as vitamins, minerals, fibers, iron. Just a half cup of raw spinach can provide you 16% of the vitamin E. You can eat spinach raw or just toss it off with the salads. Then we are having broccoli. Broccoli is also one of the important source of many different essential components. A handful of this is highly rich in vitamin E and proteins. Broccoli is one of the detox food which has anti-cancer, anti-inflammatory, different other properties also, and also lowers in bad cholesterol level. You can add broccoli to your soup and steam for a side dish. Then we are having almonds. A handful of almonds can provide you a huge amount of vitamin E and essential oils. You can snack or roasted almonds, add to the good and along with the milk. Then we are having peanuts. Peanuts are a rich source of antioxidant, monounsaturated fatty acid, and vitamin E. A handful of peanut contains almost 20% of vitamin E. Vitamin E also contains resveratrol, which is an antioxidant or lower the risk of heart attack and cancer. Then we are having different oils like vegetables oils or the olive oils. These vegetable oils like sunflower oils, olive oils are the best source of vitamin E. Then we are having some of the fruits like mango. Mango are delicious sweets and succulent fruit that can enjoyed around the world. They are also have a great source of vitamin E. Roughly 100 gram of mango provides you 6% of the daily requirement of vitamin E. Then we are having some berries like cranberries, blackberries. They are antioxidant rich food. So these are some of the foods. Then kale we are having, coconuts we are having. These are some of the specific food which are very rich source of vitamin E. So if we are going to add these foods in our food or snacks, we are going to fulfill our requirement. We have already seen that vitamin E have antioxidant properties and selenium playing a very significant role in the antioxidant properties of vitamin E. How they are related? So the element selenium is found in the enzyme glutathione peroxidase. You know that glutathione peroxidase is one of the antioxidant system of our body. So this glutathione peroxidase which contains selenium, so it destroys the free radicals. So the selenium is also involved in the antioxidant functions like vitamin E only. When both of them act synergistically, they are working very good antioxidant source. So at a certain extent, selenium can spare the requirement of vitamin E by your body also. Deficiency syndrome. When we are talking about the deficiency syndrome, I have already told you that this vitamin does not have any deficiency syndrome. So this is also called as vitamin which is in search of a disease or disorders. So the symptom of vitamin E deficiency vary from one animal species to the another. In many animals, the deficiency is associated with the sterility, degenerative changes in the muscles, megaloblastic anemia because it is required for heme synthesis, or and then changes in the central nervous systems. Severe symptoms of vitamin E deficiency are not seen in human except increasing fragility of erythrocytes because it will be rupture erythrocytes membrane, and minor neurological symptoms. When we are talking about the hyper concentration or higher concentration of vitamin E, that is called as toxicosis of vitamin E. Among the fat soluble vitamin, which is vitamin A, vitamin D, vitamin E, and vitamin K, vitamin E is the less toxic, or you can call it the least toxic among all these 4 vitamins. No toxic effect has been reported ever since the ingestion of up to 300 mg per day for 23 years. So this vitamin does not have any toxic effect, and also it does not have any deficiency disorders, except it is going to affect some, it gives you some kind of symptoms. So this is roughly all about vitamin E. Hope you have understand it. If you are new to our channel, you can subscribe, press the subscribe button, you can subscribe it. On our video also, thanks button has been activated by the YouTube. You can if you really like the video, you can press the thanks button and support us. Thank you very much. Have a nice day.